We're going to talk a little bit now about coping strategies and social support. I love this little blurb here. It says, "We are what we think. All that we are arises with our thoughts. With our thoughts, we make the world. Speak or act with an impure mind, and trouble will follow you, as the wheel follows the ox that draws the cart. Your worst enemy cannot harm you as much as your own thoughts unguarded." This has a lot to do with the way people feel about themselves and feel about their situation, and how their own feelings and their own thoughts really impacts their health. So we're going to talk about coping strategies first. So the first thing is we have active versus reactive coping strategies. You want to be active versus reactive. That means that, let's say someone was recently diagnosed with cancer. Rather than being reactive and angry at that diagnosis, you want to be active, involved. Find everything you can out about that diagnosis and know exactly what's coming up in the future rather than reacting to everything that comes your way. You want to be prepared. And the best way to do that is to be active in your care and active in your diagnosis. So maintain a positive attitude. While you have limited control over a patient or client's attitude, you can help by explaining the disease, providing positive interpretations of their condition, and putting strong value on their support systems and what aspects of their lives they do have that is positive. You want to minimize stress. Let go of obligations that are unnecessary. Communicate often about your feelings. Use I statements. Plan alone time with your partner. Encourage partners to have his and her own alone time as well. So the first thing you need to do is ask your patient to let go of all their stress. That anything that is not absolutely necessary in their life, they need to let go. Perhaps they don't need to be a part of 5 different committees and all these community functions and all these things at work. They may have enjoyed those in the past, but if it does undue stress, they don't need that at this time. Control the other aspects of their health that they can. So you can't control your physical health, then focus on what you can control. Your emotional, your spiritual, your cognitive, your behavioral health, all that plays just as big as an important piece of wellness and can be a big predictor of survivalship under any kind of disease or condition. Make sure you have strong support systems. Have support systems at home, have support systems at work, have support systems wherever you need to, whether it's social groups who understand what you're going through, online support groups. Encourage them to have some kind of support system somewhere. Peer-to-peer support is really important. This can occur in many forms. Like I said, through support groups, online forums, chat rooms, a friend, and sometimes even a patient-to-patient is the best. That's why many times in cancer centers, they have many chairs together where you can be private or you can open it up and talk with others. A lot of times that patient-to-patient support is invaluable. The family caregiver dynamic. You have to make sure you have a family caregiver support system. And again, make sure that that dynamic is positive. The caregiver may not need to be a family member. If that family member gets overwhelmed, if they're seeing differently on their plan of care, perhaps, that you don't want to break that bond. The family bond is important, and both of them should be able to have their own lives and their own things going on and not feel dependent upon each other. So sometimes that's whenever we really need to look at having outside caregivers. Medical help or support. There's medical societies, there's medical foundations, and there's lots of medical sources of health control. We need to be able to identify where the patients can find all that information and have them get greatly involved in that. So divine or faith-based help or support. I don't get a whole lot into the religion, and it's not the community health worker's role to determine what religion someone should fall into or what type of support groups they should go to or religious affiliations. We just know that divine and faith-based support works. It helps. So if they're not Catholic, you're not going to send them to a Catholic service. If they're not Baptist, you're not going to send them to a Baptist. Perhaps they're Muslim, Hindu, Teo, whatever they're Buddhist, whatever their affiliation is, we should find something that fits them. Maybe it needs to be undenominational, whatever it is, but religious affiliations for prayer or just plain meditation we know works. The internal power of virtue. Self-talk, behavioral support, and live conscious support from yourself is also a really strong thing to have. You want to make sure that they're positive and tell them it's okay to talk to yourself. Use that positive self-talk. It can change your behavior.